Hi, everyone. My name is Jessica Mabe, and I am Programs Coordinator for the International Alliance of ALS MND Associations. Today, I'm so excited to update you on where we are with the Global ALS MND Clinic Locator. Last year in the Alliance meeting in San Diego, we heard about the Global ALS MND Clinic Locator for the first time. For those of you new to this project, this global locator is an interactive resource that will enable the ALS-MND community to locate and search for ALS-MND clinics based on their location and what is closest to them. What this clinic locator will be able to do is to help find ALS-MND clinics or ALS-MND units, as not all countries have specialized clinics for this diagnosis, anywhere in the world. And as a person or caregiver looking for places for treatment, support, diagnosis, and other services, they will have a tool to locate what is closest to them. The reality is that many parts of the world still have limited access to clinics, and people living with ALS, MND, and their caregivers are always on the lookout for what is near them. In some cases, it can be in another country. This global locator will facilitate the search and hold data from a trusted source. So let me introduce you to the team of volunteers behind the Global ALS MND Clinic Locator. Pat Dolan is the heart of this project. The ideas and plans for this and future versions of this global locator have me very excited. He leads this team, and I will let him and Amanda tell you more about the locator shortly. Joining him in the team of the mappers, we have Amanda Stanko, Audrey Fuderman, Maureen Clark, and Lauren Banker-Horner. Together, they have made the global locator a reality.
Thank you, Jess. This is a passion project for me because I firsthand the value of having access to care. My ALS journey started in February of 2016 when I started a trip during my morning runs. I thought it might be a pinched nerve and scheduled an appointment with my primary doctor, who noticed that my left leg had started apathy. He sent me to a neurologist, and after a series of exams and tests, which included MRIs, blood tests, and 3 painful EMGs, I was diagnosed in July of 2016 with ALS. I was extremely fortunate to have a quick diagnosis because the average time to be diagnosed with ALS is between 6 to 12 months. The reason for the lengthy diagnosis is there are no tests for ALS. You must go through a series of tests and exams to rule out other diseases until it is clear that it is ALS. Now imagine the challenges for individuals who don't have access to ALS specialists to get properly diagnosed. People suffered needlessly because they didn't receive treatments and therapies to slow the progression of ALS, and they died quickly without realizing that they had this terrible disease. This is why I'm passionate about mapping ALS clinics and neurology offices. I want to provide the ability to find the nearest clinic and ALS specialist worldwide. This will help prevent needless suffering and improve the accuracy of ALS rates worldwide. In 2020, I launched the ALS Geospatial Hub, which brings data together by geography to discover patterns and relationships to improve care, accelerate research, and advocate for the ALS community. I organized a team together with GIS professionals, researchers, and advocates to develop the maps and applications to serve the ALS community. We call ourselves the Mappers. In partnership with the International Alliance, the ALS Association, the World Health Organization, and ESRI, we developed the global ALS MND Clinic Locator. Our goal is to map every ALS clinic and neurology offices that specialize in ALS around the world to improve access to care and increase the accuracy of ALS diagnosis. We currently have mapped 376 clinics in over 16 countries. But as you can see, the map is not complete. We are asking the International Alliance members to add their clinics so that we have the most up-to-date clinic map for the ALS community to find the nearest clinic, to receive treatments and therapies to slow the progression and maintain a high quality of life. and ALS organizations can identify the gaps in care and prioritize where resources are most needed. I hope to inspire you to fill the map to improve the quality of life for those living with ALS around the world. Thank you.
Thank you, Pat, for sharing your journey with us, and thank you for all you have done with regards to helping the ALS MND community around the world and towards the ALS MND Global Clinic Locator. I now want to ask Amanda to join us in the conversation and show us a little bit more about what has been happening with the locator. So, Amanda, thank you for being with us today. I wanted to ask you, can you tell us a little bit about what has happened with the Global Clinic Locator since we saw your presentation last year in San Diego?
Yes. With the feedback we've gotten from the community and people using the application, we've definitely made some improvements. The technology's made some advancements, so we've kind of rebuilt a different version with some more advanced technology. And we've built a more refined survey that's going to gather more information from all the clinics around the world, specifically on which services are provided at that location. So this application will allow you to find a clinic near you. It'll allow you to add a clinic, filter specific clinics, and also edit the clinics on the map. So we've definitely made some advancements in the past year. We've been working hard on pushing this forward and making it better and better.
Amanda, those are some great improvements you just mentioned. Can I ask you to go into the locator and show us where we can find some of those improvements?
Sure, yeah, no problem. So here, when you enter the application, you can see, of course, the map itself, but there's some instructions on what you can do with the map. But you can also do things like you can look for clinics nearby you. You can add a clinic to the map. You can filter by certain types of clinics, or you can go ahead and edit an existing clinic. Say some services are no longer provided there, or maybe they're offering new services they didn't before, or new staff changes. So there's some actions you can take within the application itself here.
This is very exciting, Amanda. So I'm keen to see how the locator works. So taking as an example that we are streaming from Basel, Switzerland, can you show me how to use the locator to find an ALS MND clinic near me?
Sure. So let's look at how we would find a clinic near me. So let's go ahead and look at Basel. We can zoom right in here. And let's go and look at, I could just put a clinic near me right here. So by clicking that pin, I just drop a pin what's near me. And now it's showing within 100 kilometers, those 3 clinics that are nearest me, or actually there's more, there's quite a few here. 5 are here. But there's other ways you could do it. You could draw a polygon, you could draw a line. You know, I want to know what clinics are near here. This way as well, if you're taking a route. So there's different ways you can search for that here. Or say you wanted to know even what's further away. I'm going to be looking at a larger distance. So you can adjust that as well. So that's kind of a way you can start to look for clinics that are nearby you.
Amanda, we can see in the map that there are some populated parts of the world with ALS clinics, but at the same time, we have areas where we do not have data that there are no clinics. Can you show us how, if I am aware or I'm based in a part of the world where there is an ALS clinic and I want to add it into the locator, how do I go about it?
Okay, so say, for example, look at France. We don't have any clinics yet in France. So I'm going to go ahead and add a clinic here. You just click this Add Clinic button, and the form will pop up here. So some countries are already in here, but we see France is not yet in here. So I'm going to just click Other Country. It's not listed yet. And I'll write France. The clinic, the name, of course, isn't listed yet. So I would write the name of the clinic. And then I would start writing, the address. It would start populating here. You'd write in the address itself and it would populate the address itself, and then the phone number, email. And then you'd start going through and adding which services are provided. So this red asterisk means it's a required question to respond to. So make sure you add, even if you don't know, just type unknown. But whichever services are provided, go ahead and click through and answer these questions. And then there's also the contacts at this location. So you want to add if it's the neurologist, medical director, coordinator, and then you want to add your own name and email in case the person vetting this information needs to contact you for more any other questions. It's not going to automatically be added to the map because we do want to have data accuracy, and we do check this to make sure it's correct before we put it on the map for good. So yeah, so this is the form, and then you just submit, and then we'll go ahead and review that information and then add it to the map once it's been checked.
This is fantastic, Amanda, and I can see that with time, as we get more and more data, there'll be a lot more information that people will be able to search for, depending on what requirements they have and what specialism they're after. So thank you very much for sharing that with us.
You're welcome.
Amanda, thank you so much for showing us what the Global Clinic Locator can do. And it's clear to us that the data is absolutely the key component for the success of the locator. Can you tell us what are the next steps now?
Yeah, so the next steps are we're doing the data cleanup, and we're populating the data and filling in the gaps of anything that's missing at the moment. So phase 1 is already on the way. We've communicated with some of you where we are in the data we have that we want to validate. And phase 2, we'll contact member associations where we currently have no data to get more help. Phase 3 is we're going to go to clinicians and health professionals and ALS MND clinics. And then phase 4, we're going to target areas with no data at all. So we're going to do this phased approach to try to slowly gather the data in a way that we can, the easiest we can get to the data that has been more challenging for us. But we want to really emphasize the importance of data accuracy. And it takes all of us, things change. There could be a new neurologist, a new clinician. Maybe you're offering a service that you didn't before, or maybe you're no longer offering a service that you have been offering. So keeping this information current and updating this information is critical to make it as useful to the patient and caregiver as possible. So we want an ALS patient and caregiver to search for what the services they need. And in order to keep this as valuable and useful as possible, we need to keep that up to date. So we need all of you to participate and help keeping this current and keeping this useful for everybody. Thank you so much.
Thank you, Amanda. Thank you, Pat and Amanda, for sharing all that is happening with the ALS MND Global Clinic Locator and the power it will have in helping people living with ALS and caregivers across the world in finding clinics and health professionals in ALS MND to help with their care. We also want to thank you all for the support towards this project. We have already been in touch with some of you to help us check the accuracy of the data in their respective countries. And if you haven't heard from us yet, we will be in the new year. If you have any questions about the Global Locator, please do not hesitate to reach out to the Alliance at alliance@als-mnd.org. And from all of us involved in the development of the ALS MND Global Clinic Locator, we want to thank you for helping us.